is Mr. Robbie Lopez. Okay. He was treated at St. Luke's. He spent 2 million. He was not able to walk. He went to America and spent 10 million. Oh, that's very cheap, right? It's not very cheap. He was not able to walk. Why? So he came back to the Philippines, and when he heard about me, then he said, Dr. Navarro, I've been to the best doctors throughout the world. Because he's an executive. But don't worry, I'm not hoping to walk again. Because I'm an executive, I can tell my people, do this or do that. They're big time. You know, it's David Lopez, you can afford anything. All right. But I want you only to treat me of 2 things. You take care of my, I have problem with urination, so I am on catheter already, continuous on catheter. And I am on diaper, I cannot control my bowel movement. So I know you cannot make me walk, because no doctor can make me walk. I already convinced about that. If you have been to Harvard, Stanford, and you cannot walk, you know already. And you have to be with the best St. Luke's here, you know already what to expect. Right? Now look at him within 5 months. He's walking already. Since 2007 until now. How sure I am? Because when I traveled, the pilot saw the picture and said, well, I know that man. He used to ride with me and he was on wheelchair. Now he's walking already. But he does not sit here at economy. He sits there at the business. This doctor is only at the economy, but my patient is in the business. Kasi doble ang presyo. Okay? Now look at him. Did he improve? He became younger, right? Is there improvement? Okay, right. So that's very good. Age 75 years old, and he was scheduled for amputation. But he said to his children, I would rather die with my foot than having amputated. So they have no more choice. So they brought the patient to me, and this is within 2 weeks. It's like this one had a heart attack, but in 2 weeks' time, look at the circulation. How fast? It's very fast. I explained to you how choline can totally remove all the blocks. If it were a heart attack, this is the heart attack. But within 2 weeks, it clears up very fast. Remember the case of one of the well-known from Inquirer, I won't say his name. He was treated, he had a heart problem, coronary artery disease. So he went to the hospital, to his doctor. He had a bypass, and unfortunately he died after 1 week. Now, his friend also for bypass on the same day was carrying already $500,000. And he came to me. And that's his name. If you'd like to verify this, maybe you're going to be able to use Mr. Joe Velasco. He used to work in Bulletin, and he stands by here because he was once a president of the Philippine Press Club in the Philippines. So he was already dying with severe chest pain last January, and then the wife told him, before being bypassed, he was ready to be bypassed on that day, kasabay ng isang Inquirer. Before being bypassed, why don't you drop by Dr. Navarro? So he came to me. I treated him. Now he's walking the step without bypass. So bypass can be bypassed. How easy did I do it? Right. If you have a problem and you are for bypass, kumbaga sa like just in your faucet, in your sink, right? There's a clog in the sink. So you call the plumber. And the plumber will do a bypass there. But if you call me, it's very easy. Just like you call the doctor, they will do a bypass. But they do not remove the clog. They only bypass it. With me, I'll just take a saucer, I'll pour the saucer, and the next morning, everything's okay. That happened to my patient. That always happened to my patient. The next day, they're okay. How fast? Stem cell enhanced. Oh, this is the lady. Look at her. She's about 31 years old. Okay? When she came to me, that is her condition. Okay? You see the condition of the skin and so on. She has rheumatic heart disease and she is scheduled for transplant. She needs a new heart because of 1 million. But the problem is to find a new heart. Okay? She came to my clinic, I treated her. Within 6 months, you could see the difference. This is very, very white already. It's just because there is a problem. It's so white already. That's the problem. Ang ganda na. But the beauty is so beautiful. The skin is so beautiful. You can see the difference before and after within 6 months. Okay? Maganda ba hindi? Kung bakit? Ang pangit lang kasi maitim na kasi. Ba't maputi yan? Hindi lumabas ang beauty. It's really easy as a professor. Okay? Okay, in this case, this patient is a case of the Philippine Heart Center. He's suffering from heart problems, so he had underwent angioplasty at the Philippine Heart Center in 2005, August. But because of they use a dye in the angiogram, if you have diabetes, it's also diabetic, 50% will develop kidney failure with the angiogram. So by August 2005, he was already on dialysis. Until he came to me, that was his condition, March 2006. He was on dialysis. Okay? His creatinine was almost 800. I treated him in 2 months' time at his feet. Okay? Maputi na ito eh. Hindi lumabas. It's not the color, it's really not the color. The color is white already. And look at him, he's already healthy within 2 months. And until now, his creatinine went down to 200. I was not able to pull it down below 200, but it's okay already. This is another case. He's suffering from gastric cancer. He was treated by different hospitals and different doctors. His name is Romaldo Lilo Mercami, 67 years old. Okay, gastric cancer. This condition started last 2008 when the patient experienced epigastric pain. He took herbal medications and over-the-counter drugs, but to no avail. The patient eventually experienced blood stool. He was passing a lot of blood. He was confined in Bernardino General Hospital and underwent several diagnostic procedures. But still, the patient experienced episodes of blood stools. On and off confinement continued. In January 3, 2009, the patient underwent CT scan and revealed hypotense in a moderately soft tissue mass with lobulated borders seen in gastric cardia, extending to the pelvic figure, measuring 5.9 by 8 by 5 centimeters, just as large as the cancer of my patient that I treated with renal cancer, about 3 inches. Okay. The physician showed me that the mass was about the size of Macopa. Okay? And it has the tendency to spread easily. The physician told him, he said that it was gastric stomach cancer. So the patient was given palliative care and was advised to undergo chemotherapy, okay, or surgery, but he did not want to. He was again confined last July 18 to 25, 2009 due to bleeding. As he said, I was told that he will not live long and eventually die because of massive bleeding. Yun sabi sa kanya ng doktor niya. He will die massive bleeding. As far as he can remember, he was transfused with 30 bags of blood. Marami ba? You usually require only 1 bag or 2 bags, but this is 30 bags already. Then he said, I ran out of hope until my son told us to consult Dr. Navarro. We consulted him last August 2009. After taking, he was almost semi-comatose already. He said, after taking the rapid cellular balancing, I saw with my own eyes, how he was able to stand up. And that is the yung ano ng misis niya. Nakita ng misis niya. And remarkably became stronger. I cannot believe it. His latest full abdomen ultrasound is normal. No more cancer. And that was, I think, in 2009. That is McCamey. This Joyce Poe. Joyce Poe suffered multiple sclerosis. I treated him, I think, about 2005. And she's the hardest case throughout the Philippines. From at the age of 10 years old, he was treated at the PCMC, Philippine Children's Medical Center, by the chief neurologist. Then she was transferred to the UST hospital. And from there, Joyce Poe was sent to the Makati Medical Center, where she was treated by 17 top neurologists. So the Makati, St. Luke's rather, St. Luke's invited 17 top neurologists, but to no avail. So they invited neurologists from America. They came to the Philippines and treated Joyce Poe, but nothing happens, and Joyce Poe became comatose already. And she was on and off comatose for 3 days. So the doctor handling her became the senior consultant neurologist says, Joyce Poe might die anytime. So she decided to refer Joyce Poe to me. So when Joyce Poe was brought to me, he could not recognize the parents anymore, this multiple sclerosis. Okay? When they put her down, like he had seizures, so severe that she fell down. Is it serious or not? Yeah, serious, right? And she lost her mind. She cannot recognize anymore the parents. Now I treated Joyce Poe, 2005. I even anointed her. But it's so fast, I cannot imagine. After a few minutes, she stood up and says, Mama, Mama. She was able to recognize the mother. She went to the CR, the mother followed, she came back. And she already operated the computer. Before, for 2 years, she cannot do the computer. She was already in sound mind within that few hours, few minutes of few hours. And that's so fast, I could hardly believe that. After a few months, Joyce Poe entered school because she was absent for almost 2 years. So she took the exam, she topped the exam, and she was accelerated from grade 3 to grade 6, global acceleration. So even the brain is back. So that is the beauty of the Krebs cycle and electron transport chain. Another one is this one. This is the case of bronchiectasis. Okay? She was throwing up blood. She was brought to the lung center, and the lung center says there is nothing that they can do but to do lobectomy. Remove part of the lungs. So they don't want it, so they went to this Jerty Yumping, okay. So they went to the ano ba yung sa tuberculosis dito? QI, Quezon Institute. The same verdict. She had to undergo lobectomy. Okay. And that was her condition. She was brought to Medical City due to pneumonia. It occurred in July 2001. I was given Hemoscan and so on, and anti-TB drugs. With the same complaint, March 2002, I was back to Medical City due to bronchiectasis and was advised to undergo lobectomy, surgical removal of the 2 lobes of the lungs. I was brought to QI for second opinion, but same advice from the doctors. After 2002, I was brought to Dr. Robin Navarro, breathless, very pale, with cyanotic lips and fingers and weighing only 78 pounds. I was given RCB, and after 4 months of treatment, I improved greatly, no more blood in sputum, and I gained 30 pounds. Now I am very healthy. She's now top of the school. So that is Jerty Yumping. Her age is 40. Okay? This one is a nurse. Okay, suffering from atopic dermatitis. Okay. Anong year? I think I did it about 2007, 2008. Atopic dermatitis. He was treated by several doctors in Manila and several hospitals to no avail. He came to a point that he was so depressed, he wanted to commit suicide. But the wife said, let's try Dr. Navarro for the last time. So he was brought to my clinic. Okay, I treated him. And after my treatment, there is no more recurrence. And that is his picture after 2 months. Within 1 month, everything is clear already. After 2 months, and right now he's abroad. Okay. Look at the boy, also with the same condition, and look at the skin within 1 month. How it improves very fast. This is cancer, stage 3 cancer, a patient of the North General Hospital. That's Jose Reyes. Now look at her.